What is eczema? What is acne? And can you have both at the exact same time? Well, today we're talking about skin health. I'm Dr. Mosamtombene, and welcome to Vital Signs. Now, we've got a jam-packed show for you today because we're looking at something that a lot of people don't actually pay attention to, and that is the largest organ on and in their bodies, and that's their skin. And we'll be taking you through a journey of exploring this and seeing all the big problems that you could experience with respect to skin health. Of course, we'll be joined by a number of guests on the show today. We have a dermatologist who will be taking us through all of the little things that we need to know about the conditions that I've mentioned, that being eczema as well as acne, and maybe many other things that you need to look out for, as well as us being able to speak to a dietitian who will be taking us through what food will actually affect this health of your skin. And of course, we've got some packages, and those being inserts that you'll be able to see from people that suffer from acne. So now that you know what's happening on the show today, let's tell you how you can get in touch with us throughout the show. Remember that you can be part of the show by asking the guests that we'll have on any question that you have on your mind. Simply give us a call with the number that's on the screen right now. And of course, we'll take that call and answer any skin health related questions that you may have for us. Also available on social media at SABC Vital Signs on Twitter and SABC Vital Signs on Facebook. The show takes a quick break and we'll be back after this. Welcome back to Vital Signs. Now, Tshegofatso Mokate's skin transformation trended on Twitter when she took part in the challenge called How It Started and How It's Going by posting a before and after picture of her face. Producer Nompilo Gwala spoke to Tshegofatso about how she struggled with acne and how she's dealing with it. Take a listen.
Acne is a skin condition that shows up as different types of bumps, blackheads, whiteheads, pimples, or cysts. Teenagers get acne because of the hormone changes that come with puberty. Also, if parents had acne as teens, children are more likely to get it. While for most people, acne goes away almost completely by the time they're out their teens, some experience it throughout adulthood. Tshegofatso Mokate from Tembisa in Gauteng is one of many who struggles with acne. She shares her journey with us.
I've had problems with acne since I was like 15, which are the minimum ages of starting to have acne, of course, which is where you start your puberty, your body changes and whatever. So that was when I first started having problems with my skin, but it was really mere acne, not severe. It was just mid. It started getting severe when I was 18. Which that was when I started having really severe acne, and it got so worse, it literally got out of control.
Like many, Mokate tried different products that were recommended by people through a very painful period when her acne started to get worse. Like many who struggle with acne, this has also had a huge impact on her self-esteem.
My acne became severe because I used a particular product when I was trying to treat my very mild acne, and then it literally got worse, which then led me to going to the doctor. Well, first I started by treating it by myself, like any other person really, just using drugstore products and whatever. Then I saw that none of that is helping. I then went to the doctor, which the doctor then gave me pills, which helped me heal my acne. Acne is very irritating. It's very irritating to the skin. I can't even describe it. You literally feel like something is on top of your skin and you can just rip it off. It just feels, and also the pain as well from some pimples, of course. You also feel like it's just a rough texture on your skin that's just irritating.
It was only when she decided to see a skin doctor that things started getting better.
My self-esteem was really down. I had no self-confidence whatsoever. It was just so bad. And also my pills, the side effects of the pills that I was drinking, or depression. So you can imagine all, like, everything that's happening on my face, plus the pills, plus it was just a lot. I was just not myself.
She was put on treatment for 6 months. However, her doctor warned that things were about to get worse before they got better.
The first 2 to 3 months, it's gonna get worse. Like, it's literally taking out all the pimples that you have on the outside, and then they dry up, and then they fall off.
This is her advice for people with skin conditions.
My skin is so much better, and also I've started using like serums and stuff, so it's really getting better, because after my medication I had like hyperpigmentation, because that medication doesn't like really do all the job. I mean, like, you need to use some products to better your skin. People should really trust the process. I mean, like, if you are seeing a specialist, I think they know best with what they are doing to your skin. So trust whatever they are telling you to do. Trust, like, whatever that they have given you, just put your trust in it, take your medication as required, and I think you'll be fine.
After the break, we'll speak to Dr. Taryn Jacobs, a dermatologist, about skin health, focusing on acne. Stay with us. Welcome back to Vital Signs. Now, acne is one of the most common skin disorders affecting teenagers and young adults, and is becoming increasingly common in middle-aged women too. Now, it affects all skin types and ethnic groups. And joining us to talk about acne, and I'm listening very keenly today, is dermatologist Dr. Taryn Jacobs. Thank you so much for joining us again.
Thank you for having me.
Lovely. So last time you were here, we spoke about skin cancers and all the things people need to do to protect their skin. But sometimes the issue isn't the sun. Sometimes the issue is the skin itself. So we're going to talk about acne now. And I want you to give a brief descriptor of what acne actually is.
So acne is an inflammatory skin condition. It's actually one of the most common conditions of the skin globally. Up to 90% of people have been affected by acne at some point of their lives. And it's just a medical word for how we describe spots, breakouts, pimples, basically. So it's a condition that affects the pilosebaceous unit, so that translates to the hair follicle and its associated oil gland.
Okay.
Like we've heard, it manifests in a variety of different ways, from blackheads and whiteheads, which we call comedones, to more inflammatory lesions, red bumps, pus-filled spots, deeper lesions that are under the skin that don't come to a head, called nodules and cysts.
Now, different people have different types of acne then, it seems. I know I've had very bad skin for basically most of my life, where these pimples come out and you try this product and you try the other one. So with these different types of acne that you have, are there more severe forms that would require more extensive management?
So when we talk about acne, we're usually talking about acne vulgaris. That's the common type of acne, but there are different variations of acne. So we have acne that is caused by medications like steroids, oral steroids, anti-epileptic medications, and we touched on this. We have acne that is caused by makeup, so cosmetic products. That's called acne cosmetica. There are acne variants called acne mechanica. That's something that we've seen a lot during the pandemic with mask wearing, which is actually friction and occlusion on the pores. But when we're speaking about acne now, we're talking about acne vulgaris, and there are many different causes to that.
Now, when we talk about the very common types of acne, I think you've slightly alluded to it, are the different types that you'd have. Are there different causes for acne? So, for instance, if my mom had acne and I have acne, is it a genetic thing? What are the different causes that we have?
So just touching on genetics, first of all, it's multifactorial, many different causes. Genetics-wise, you know, the size and the activity of your oil glands are inherited. So it's genetic in that way, but there's no specific gene that we know of. But multifactorial, and it starts with increased oil production, which is really mediated by hormones, which we call male sex hormones, androgen hormones. Even women have it in small amounts. At the same time, at the hair follicle, the cells lining the hair follicle become cohesive, sticky, they don't shed properly. And so you have a buildup of oil and dead skin cells, and that's what leads to clogged pores. Additionally, there's a role for an overgrowth of a bacteria called C. acnes bacteria, which drives inflammation. So those are the key factors that are involved.
Now, age groups. I mean, when you're young, when you're 12 or 13 and you start to get a few spots, a lot of parents will term that as normal, as part of growing up. What age groups merely or really suffer from having acne?
So you can get acne, and we've seen it as early as from 9 years old, and what really drives it is this when the hormones kick in puberty. So in adolescence, what happens is your androgen hormones that we spoke of, that is being produced by your reproductive organs as well as the adrenal glands, and it starts with that influencing the oil gland, and then you start reproducing oil. So adolescent acne is most common, but we know that you can get adult acne, adult female acne, you can get it well into your adulthood.
A lot of people speak about having stressful times in their life where the acne started to flare up. Is this something that also contributes to people having acne?
Yes, yes, it can. And as dermatologists, we're only well aware of that significant role that psychological stress can have on triggering certain skin conditions. And so even studies recognize what we call the brain-skin axis. So that is like a concept that describes the interaction between the immune system and the nervous system and the skin. And we see that stress hormones can actually trigger a lot of inflammatory conditions like acne, like atopic eczema, psoriasis, and rosacea. So it's well established.
Now, we spoke to the idea that, you know, when you're younger, you've got the hormones that are starting to kick in, and that's why you would see that sort of acne sort of showing itself at that point in time. For adults, why is that the case? So if you're, for instance, a 30-year-old man who, you know, hasn't really had any issues and you start having flare-up of acne, what could be the driving cause behind that?
Very much the same causes, those factors that we spoke about previously. And it is a misconception that most people think that acne is something you're going to clear as you get older, but actually up to 40% of adult women have acne. It's a lot more common than what we think. You can get it for the first time in adulthood. Again, hormonal factors are playing a key role here.
Let's talk around the early management of some of these things. Now, when you were a kid, and even now, you get a spot on your face, it feels a little soft, and you decide, let me pop this thing. Maybe the acne will then go away, or that one spot will go away. Is this something that we should be doing? Should you be picking, especially with, you know, social media existing? There's so many pages of Dr. Pimple Popper and all that sort of stuff. Should we be popping the pimples on our face?
And there are instruments that I've seen on social media that people go and buy and try and do that. It's generally not a good idea. It can cause skin damage. So you can cause permanent scarring and even post-inflammatory pigmentation spots as well. A better thing, and I know it is tempting, but a better thing is to use a spot-directed treatment onto that pimple. So there are products with things like benzoyl peroxide in or salicylic acid in, and that really helps to dry it up really quickly and cool down and settle the inflammation.
We've got a caller on the line, Anita from Johannesburg. Good day. Thank you for your call.
Good day.
Hi, how are you, ma'am?
I'm all right, and you?
Good. What's your question this morning?
My nephew, he's 23, and as he was growing up, he started getting all these white spots on his eyebrows, on his eye, up on his eyes, and on his hands, and part of his body and on his back. He had acne, but we don't know what caused the vitiligo. Could you explain to me?
All right, so you've spoken about two different things. I need to understand something also. I think the doc would have a few questions maybe to ask is, are you saying the spots were like pimples, or are you saying that was starting to have a discoloration on the skin where the skin became whiter? Which one is it?
It's the discoloration.
The
but
discoloration.
He did have acne before that, and the acne went away, and then the discoloration came.
In the same spot where the acne was?
No.
Okay. All right. So I think we're talking about two different things here. The idea that there is acne and the idea of vertigo. So let's maybe touch on that a little bit. What is the difference between these two things?
So different causes. We spoke about acne. Vitiligo is best regarded, although we don't know the exact cause, but we think it's an autoimmune destruction of your pigment cells called the melanocytes, and there's a lot of genetic factors involved. A lot of patients come in not knowing that there are actually good treatment options there. We cannot cure it, but I would definitely seek some medical attention and discuss the therapies available.
And that's for the vertigo?
That's for vitiligo.
Okay, so let's talk about acne now and the treatments that do come across. So here is a 17-year-old. They walk into the office. They've got very bad acne. I think in the insert a little bit earlier on, we saw that as well. Tsegofatso had really, really bad acne. How do you approach managing acne in that sense? So let's look at two patients as an example. There's one that's got very mild, very puberty-related acne, and then the other is someone with severe acne. How would you manage both?
Well, you're absolutely right. We have to look at the severity. So we choose our treatment approach depending on how severe. If it is mild, if it's moderate, if it's severe, and you also want to examine the skin and see if there's any sequelae. Is there any acne scarring? Because we then may opt for more severe type of treatment management plan. So acne scarring is basically can be raised or it can be depressed, and it looks like little indentations in the skin. We call it atrophic scarring, and that's really important to prevent because it's very difficult to treat. So with mild acne, we have topical therapies available. That means these are skin-directed therapies you apply onto the skin, and one of the backbones in acne treatment are vitamin A compounds called retinoids, and they are brilliant in really just increasing the cell turnover rate and for inflammation. And then oral or moderate acne, oral tablets, that would mean oral antibiotics. We have hormone modulating tablets for females, like the combined contraceptive pill. For severe acne, we're thinking along the lines of something called isotretinoin. We use that for patients also with scarring.
So these medications range from being topical products or stuff that you can put on your skin to handle the acute breakout that you might be having, to more severe things where you take treatment for some time period. What happens if all of that fails? So let me give an example. I'm someone that has had acne in the past. I was put on all kinds of things, antibiotics and at this point I'm starting to flare up again. But I use a lot of makeup, for instance, on the show. So it will create that balance where, you know, I have in theory treated this, but I keep adding issues to my skin to give that problem. So how do you manage someone with a more complex acne picture?
I think it's important to understand that for the majority of people, we consider acne as a bit of a chronic problem. You know, you get treatment, it may be whatever treatment, but you still need a bit of maintenance when things are clear. So, and that maintenance product, which is usually a vitamin A-based cream, it's often lacking. Many people would need a second course of isotretinoin. After you've done one course, about 30% will need a second course, even if you've done a proper course. And very rarely do you need more courses, but it is a chronic condition for which you may always need either something in your skincare routine or some form of medical treatment for.
All right, before we wrap up our acne discussion, we've got a call from Anonymous. Good day, thank you for joining us.
Thank you, good morning.
Good morning, what's your question today?
I just need to inquire when my daughter has a skin age pimples. It's not severe, it's moderate. However, it leaves us dark marks, the dark pigmentation. So I want to know how to go about it in clearing up the skin, which products to use. Currently, I bought those skin wands, all right? Because also I've noted when she's on a period, it tends to come out again.
All right, thank you for that question. We'll let Dr. Jacobs let us know what the answer to that is, okay? Thanks. So, Doc, simple one, someone that has acne, occasionally due to a period or a cycle will flare up, but the big issue are the dark spots that are there. How do we treat them?
So that is what we call post-inflammatory hyperpigmentation. It's more common in skin of color. The big thing is you need to treat the acne effectively to prevent that. But there are certain lightening agents that can be used, varying from prescription agents like hydroquinone-based therapies to things that you can buy in the shop with kojic acid, glycolic acid, and then again, vitamin A. Also be aware that you really do want to be using a sunscreen daily because sunlight is what exacerbates those pigmentation spots.
Now, a lot of people with social media start seeing things like drips that will give you a glow or, you know, lighten up your skin a little bit more. Are these things or therapies that people should be going after to get rid of these hyperpigmentation spots?
Definitely not indicated for treatment or anything to do with acne. And actually, these treatments are quite unregulated. Long-term safety studies are not there, so it's nothing that I would recommend as a dermatologist.
So just to wrap up our acne discussion, in terms of treatment and managing it, what are the big things we need to look out for in order to manage your acne successfully?
So I think basics. A good, consistent skincare routine is needed as well. And that starts with cleansing your face effectively. So you really want to remove the dirt and the bacteria and the oil from the skin at night. And then you follow that up with a light moisturizer because even oily, acne-prone skin needs some maintenance for the skin barrier. And then, like I mentioned, sunscreen which helps to prevent the dark spots from getting worse. And lastly, if you really want to get ahead of acne and prevent spots from forming, that is where you need that vitamin A-based product, a retinoid, in your skincare routine.
Mm-hmm. And how long before you start seeing results? I think this becomes one of those things where, you start using the products and 2 weeks in, you've actually looked worse than you did last week. So how long should people expect to get better in terms of the acne once they start using the different products?
So I tell my patients, really give it a good go. All those processes, they take a while to turn off. So you need to give it at least 4 to 8 weeks to start to see the benefit. And for skincare products, even longer, up to 3 months, to really see that it's starting to work.
Well, we continue our discussion with Dr. Taryn Jacobs, a dermatologist, about skin health. Just looked at, of course, acne, and after the break, we'll be focusing on eczema. Stay with us. Welcome back to Vital Signs. Now, eczema is a skin condition that is commonly known to affect children and is most common in urban more than it is in rural settings. Now, as patients in South Africa have very little access to specialist healthcare, a practical approach is needed for the management of mild to moderate eczema in patients. We continue our discussion with dermatologist Dr. Taryn Jacobs. So before the break, we spoke about acne, which a lot of people, I think, would be very familiar with. But eczema is not something a lot of people are very common in terms of understanding. So what is eczema?
Sure. So I think let's clarify. When we're going to talk about eczema now, we're talking about atopic eczema or atopic dermatitis, which is interchangeably used with the term eczema because it is common. It's one of the most common types. So it is a condition that's a chronic inflammatory condition that can manifest as itch, generalized dry skin, as well as a rash. So the cause is a little bit complex. It's a complex interplay between a number of different factors. There's a dysregulated immune system. There are environmental factors like allergens which play a role. And then for many people, there's a genetic component. And that is a deficiency of a protein called filaggrin. And that protein holds skin cells together. So it leads to this compromised skin barrier or a leaky skin barrier. We want our skin barrier to sit nice and tight and strong. So water leaks out, like water leaks out from a colander. Things like irritants and allergens and pathogens like bugs, bacteria, viruses get in, drives the immune system absolutely crazy, and this leads to itch and inflammation, and which in turn also then feeds back and damages the skin barrier. So it's like a vicious cycle in a way.
So how do you spot eczema? A lot of people love to say, oh, my cousin or my gran or whoever might have eczema. But what are the things we need to look out for, and where on your body could you have eczema?
So I think it depends at which age it is presenting at. So we know that in infants, it looks very red and oozing and weeping, predominantly on the face, on the extensor surfaces, which is the outside of the arms and legs. Whereas in older children and adults, it typically would present on the flexural areas, which is the crooks of the elbows, the backs of the knees, and it looks as just like dry, very thick skin in those areas. One of the cardinal symptoms is itch, and that is something that sets it apart. It's an extremely itchy condition, and that can really affect someone's quality of life.
So how do you get to a diagnosis of eczema? I mean, it's one of the conditions, as you explained, that would potentially come and go. So it would flare up and you'd be itchy and scratchy and you'll come up with a solution at home, and then things feel better. Then a month later, you've got the same problem again. So how do you make this diagnosis?
So, I mean, it's something that's commonly recognized by medical professionals. It's a clinical diagnosis, in other words, and we have described how it looks like, but you don't need any blood tests routinely or any skin biopsies to make that diagnosis. You take into the account of the chronicity, if it's a long-term itchy condition, if it looks like eczema in the usual spots. Those are some of the major criteria that we look at to diagnose atopic eczema.
Is there anything that can be done to prevent someone having eczema?
Yes, so I mean, going back to what causes eczema, we often will tell our patients to avoid certain things in the environment, like products with fragrances, products with certain preservatives. Those are well-known triggers that can flare up your eczema. And good general skincare is very important. So what By that, I mean the use of emollients or thick moisturizers that can coat the skin, prevent the penetration of irritants and allergens and microbials, but also prevent the increased water loss. So that is something that you can do from home. And of course, there's medications as well.
What worsens eczema in this case? So we figured out how to prevent it. What makes eczema worse?
So, like I said, many triggers in the environment, and it can be anything like heat, stress, again, that's the link with the neuroaccess, dust for some people, pet dander, and then personal care products that really can trigger it. Atopic dermatitis is not an allergy necessarily, but we do need to be careful of what we're putting on the skin. And I think less is more in this case. Look for things, the words hypoallergenic, fragrance-free. That's usually a good place to start.
Are there any associations that people would have if they have eczema? Are they supposed to, or could they have other things?
So I think one of the big things that come up in clinic is the role of diet and food allergies being associated with atopic dermatitis. In fact, many people and families incorrectly suspect that the root cause of the atopic eczema is some sort of a food, their diet. But it really is more complex than that, unfortunately. We know that atopic dermatitis and food allergies are associated. In fact, up to a third of people with moderate to severe atopic eczema actually have food allergies. But just like I explained in clinic, just because there's an association between fire trucks and fires doesn't mean that the fire truck causes the fire. Just like eczema, it's simply an association. So in that regards, we would only suggest testing for food allergies if the child has severe atopic dermatitis, if it's not improving to the standard medical care, and if there's immediate reaction. And the big things would be peanuts, eggs, and cow's milk. But what I really want to drive home when it comes to that kind of trigger and dietary restriction should only be done really under the guidance of a medical practitioner.
We've got Anonymous on the line. Good day, Anonymous.
Molo, Dr. Mdobeni.
Ninjani tata?
Siyaphila kusekunjani Dr.
Siyaphila tata. Umbuzo wakho uthini namhlanje?
Dr. Apha ndina 46 years. Ndiyabe dutywa.
Ewe tata.
Ndineproblem yamanzi. Apha yandiqala ngo-94. Xa ndihlambayo ayandiluma amanzi. Gqitha loo nto xa ndikohlamba ilasa into engapha ko-15 minutes. So ilasa into phaa ko-15 minutes loo nto leyo.
Yenzeka sonke isikhathi mawuhlamba tata, or yenzeka from time to time?
Sonke isikhathi ndihlamba Doctor. Okokoko ndanyamezela loo nto from 1994.
And then insipho oyisebenzisayo usebenzisa eyiphi insipho? Usebenzisa insipho efanayo noma boloku uyichange still ube nenkinga efanayo?
Doctor.
Sorry tata?
Ndiyatshintsha.
Uyashintsha and still uba nenkinga efanayo?
Ndiyatshintsha.
All right. Ngiyabonga baba. So a caller there from, I think it was the Eastern Cape, if I'm not mistaken, speaking about this idea of whenever he baths or takes a bath, he has this itchy, sore reaction for about 15 minutes after he's taken a bath. He says that he has switched around the different soap bars because he did think potentially that it might be just a specific soap, but it's been happening since 94. But he does mention that it's the water when he uses it in the area that he's in.
That is something I often hear from my patients. And remember, because of this barrier dysfunction, even something like water can irritate the skin, especially the temperature of water. So a couple of troubleshooting things there. You must make sure that the water is not too hot. So it should just be, lukewarm, tepid, comfortable. But hot water can also dry out your skin and cause itching. And then you want to make sure that you're not soaking in a tub or whatever bucket, applying it for too long. So keep it short, 3 minutes usually is what we say, or showers in that matter. And then immediately when you get out, you want to actually seal in that moisture, and that's also going to help with itching. And so we do a pat and smear. Don't dry your skin properly, just pat it in, lock it in with the emollients, the moisturizers that we spoke about. And then I touched on about what products to look out for in terms of what to wash for, avoiding traditional bar soaps that can strip the skin of lipids, which are the fats that we need for the skin barrier. So I think all of those kind of tips can really help to make the process a bit more manageable, but it's a very common concern.
Now, let's look at the management of someone who has a severe eczema or those that have a mild eczema. How do you manage these two patients?
So I like to think of it as in different pillars of treatment. The first pillar is skin barrier repair, and that is the role of using the emollients, the moisturizers, to help and protect the barrier.
I mean, you've used the term emollient, but what does that look like at the shop? Am I picking a product that's very oily so I can lock in the okay.
That is a very good question. So, I mean, you know, honestly, as a derm, the greasier, the better, the thicker, the better. I know a lot of the teenagers, they're not fans of those things. But you can use an ointment and you can use a cream. And a good place to start is just by looking at something for dry or sensitive skin or eczema-prone skin. Generally, these things are not going to have any irritating ingredients.
What about petroleum jelly? Is that something that people should be using?
Absolutely love petroleum jelly. It's inexpensive, relatively affordable. It's inert. There are good studies for it used in atopic dermatitis. It's definitely an option.
All right, so the first step would be to find yourself a moisturizer that you could use on your body if you have eczema to apply to the areas where you do have those flare-ups. All right, what's next?
So that's the first pillar, yes. So the second thing is actually controlling that inflammation. We spoke about that inflammation. So what you see when you or your child is itchy, when there's this red rash, is inflammation in the skin, certain chemicals being released and causing inflammation. And it's for that reason that moisturizers are not enough. So we really need something that we can use to dial that down. And that is where the role of topical corticosteroids come in that is a medication that you apply to the skin for an anti-inflammatory effect. Now, these steroids, they're not the type of steroids that's going to, you know, help you build muscles or become a star athlete. They're actually similar to what is in your body, just in a topical form, what you're using on the skin. What I will mention is there's other creams as well, prescription creams that we use that are anti-inflammatory, that are non-steroidal. So if you need a bit of a break, or if you're in more of a maintenance phase, then we'll use that. There are systemic anti-inflammatory tablets, so oral medications as well, to help modulate the immune system, anti-inflammatory action. And then that's for more severe cases, moderate cases as well. Moderate therapy, we're talking about also light therapy, something called phototherapy, which is anti-inflammatory and really helps get control and dial down that inflammation.
We've got Catherine on the line from Mpumalanga. Good day, Catherine. Hello, Catherine. All right, we seem to have disconnected with Catherine, but I think we can continue our discussion around eczema. Is eczema rather something that can go away? Is this something that I have as a child and then as an adult I never have an issue with it again, or is this a lifelong chronic condition?
Well, it depends, and it depends on the individual. We certainly see that in most cases it does go away by adulthood, or if it does persist, it's usually very mild, maybe just a hand eczema. And then again, it can start in adulthood. There's a senile variant where you can get it for the very first time after the age of 60 years. So it's difficult to predict, but we usually see that if it persists into adulthood, it's usually a milder form.
Now, to wrap up our discussion around eczema, I think I'll bring in our first topic, which was the acne. Do you find it difficult to manage patients that have multiple skin conditions going on at the same time? So if you're a younger 15, 16-year-old with chronic, severe or moderate eczema, but also now have that hormonal thing happening where you're going to get acne, how do you manage a combination of these things?
I think the first thing is to see a dermatologist, because it is definitely very tricky to manage on your own. If you think of some of the treatments for acne, the topical therapies are very irritating on the skin. Now, if you have an underlying barrier, skin barrier function, it means that you're going to get irritated. You may even see flare-ups of your acne. There is really a fine line in balancing acne and eczema treatment, but I think getting personal medical advice for your specific grade of acne and eczema is really going to help.
To wrap up our discussion, any big things that we need to look out for in terms of other important skin health ideas that we need to be aware of?
When it comes to atopic eczema?
Just skin health in general, yes.
Well, I think I'll build on what I spoke about last year, and that is just making sure that you are using daily sun protection. That can really prevent a lot of issues, Skin cancer prevention, as well as pigmentation things, that's another common thing that we see because the demographics in our country, we all mostly have skin of color and we are more prone to develop pigmentation. And just be aware that that UV light can drive that process. So perhaps a topic for another day.
Maybe a topic for another day. Before we let you go, we've got Bongo Musa from KZN. Bongo Musa, hello.
Yes, Nijan Baba.
Nompilo Gwala.
Hayi number one please. Hayi ngitha ake ngifake ngi-emphasize nami la kukhona ikhola lensizwa yase-Cape Town eke yakhuluma ukuthi kuyiqeda ukugeza kuvele kuluma umzimba into ongayazi. Nami nokungenza leyo nto leyo. Kodwa-ke into bengisengiyaye ngiyeze bengivele mhlawumbe ngigeze ekuseni kakhulu ilanga lingakaphumi then mhlawumbe kuba ngconywana ukuhluma lapho. But ake ngidlule lapho okunye bengifuna ukukubuza lapho. Uyabona njengoba kuyisehlobo enyaweni lapho kuvele kuvuka ama-blisters njengoba kushisa kuvuka ama-blister uyiphophe out ishe then mase lokhu unyawo kube ngazi selokhu kuyaxebuka even nasezandleni angazi ukuthi ikhozwa yini but yabona nje mengena isizini yokushisa mase kushisa nje kuba nama-blisters endaweni engazi ukuthi kade ugqoka ibhuzu uyabona but manje sengihlezi ngigqoka uphathi qapha still abakhona.
Sizwile baba, siyabonga.
All
right. So Bongo Musa's issue was a similar one to the other caller, a water one. But he says now that it gets a little bit warmer, he starts to have blisters in and around the feet as well as within the hands. Is this a common thing that people come and complain about?
Well, difficult to say, but it sounds like a different type of eczema that we often see in atopic dermatitis, and that is called dyshydrotic eczema, or other word is pompflex. So people actually have these deep-seated vesicles, small little blisters that are extremely pruritic. On the hands, fingers, and on the feet as well. That would actually need some medical therapy in forms of a topical anti-inflammatory, topical steroid. And often there's an underlying irritant contact dermatitis, which is, again, the cause of this eczema.
Well, thank you so much for joining us and assisting us once again as we look at skin health. Babongosi, I hope uzwile ke hambe yobona udokotela ukuthi bazokhona ukukusiza kahle bakutshela ukuthi imithi ongayithatha yini ukuthi ke lawo ma-blisters okhuluma ngawo akhona ukusuka ngesikhathi wonke. This, of course, was Dr. Taryn Jacobs, a dermatologist. After the break, we'll speak to Ngubane, a dietitian, about how your diet affects your skin. Stay with us. Welcome back to Vital Science. Today we're talking about skin health. Let's listen to a young woman sharing their views on the foods that they think trigger acne outbreaks and what foods may trigger a flare-up if you already have eczema.
The foods that actually affect my skin are foods such as peanuts. Anything that has peanuts would affect me tremendously. Also chocolates. Your unhealthy foods such as hamburgers, pizzas, also rich foods such as your cheese, your milk, so yogurt. Any dairy products would also affect my skin.
I usually get an allergy reaction on my hands whenever I eat stuff that comes like from a tin, for example, like fish and stuff, and I sometimes get a rash on my arms.
I've had eczema for about 8 years now, and the foods that cause my eczema or trigger my eczema would be canned foods, so tin stuff. Another thing is the changes in season. Especially in summer, my skin is really irritated by the heat, and also if I'm wearing like wool clothes, my eczema starts flaring up. Also, if I use soaps that are very scented.
The foods that trigger my acne are dairy products, sugars found in cool drinks, chocolates, and other sweets, as well as fast foods that contain lots of oil.
Interesting views. Now, your skin is the largest organ on your body. Protecting it from the outside pollutants and chemicals can be a challenge, but what you eat every day might make an even bigger difference. Joining us to talk about this is dietitian Ngubane. Thank you so much, Ntokozo, for joining us.
Thank you for having me. Good morning.
Lovely. So, diet and skin, how do these two come together?
Well, a well-balanced diet is ideal, and we need that for overall health. But as you mentioned also, our skin is the most part of the body, our body parts. And obviously it has specific requirements, nutrition requirements for it to stay young, to stay fresh, and to stay vibrant. So our skin, to maintain its healthy skin, we need a wide variety of nutrients from our fruits, our vegetables, our carbohydrates, our proteins. These give us some properties that might help to protect the skin. Our skin is constantly exposed to sun damage, aging, thinning, and we need proper nutrition to make sure that our skin is staying healthy. But also just to keep in mind that, like Dr. Jacobs was saying, skin conditions and skin disease are multifactorial. Diet does play a big role. However, it's not an all or nothing. So it's not just one miraculous food will prevent or will cause acne. However, certain types of food can worsen the severity, and we need to be aware of what works for you. Also, there isn't a blanket diet for everyone in terms of skin. Our bodies are different, our skin are different. Everything that we have to do for the skin is personal, and it's an approach that has to be on a personal level and not a blanket nutrition plan.
Now, we're looking at two conditions today, eczema as well as acne. Let's, for each one, discuss which foods should be avoided in order to have healthier skin for each condition.
Yeah. So I think also we need to first to understand what food we need for our skin that will make our skin vibrant. So like I mentioned, that we need a wide variety of our proteins and our vitamins. So the vitamins that are most important will be your vitamin A, your vitamin E, your vitamin D, and your vitamin C. Why those vitamins are important? It's because it will give you the antioxidants effect, your anti-inflammatory effects. Dr. Jacobs was explaining that acne, for example, is an inflammation disease. So these nutrients that you'll be getting from your food will offer those anti-inflammatory effects. So where we get these type of vitamins and minerals would be from your fruits and vegetables. So our food-based dietary guidelines in South Africa do encourage that we enjoy a variety of food. We eat plenty of fruits and vegetables. Fish, meat, chicken can be eaten daily. So those are the foods that will give you the vitamins that you need. The vitamins will help in terms of antioxidants, anti-inflammatory, as well as your collagen production. So in terms of what to avoid, again, it depends from person to person. I think we saw it from the previous videos that the different ladies who were explaining what flares up their acne or eczema, it's different foods. So we need also to take into account food allergies and sensitivities. When it comes to that, if you have done a food allergy test and you've seen that, okay, I'm allergic to nuts, it's also very important that you go see your dietitian so that you don't just eliminate a food group in your diet, but then you get a plan to see how are you going to eliminate that food type, but also still meet your nutrition requirements that you need as an individual. But recommended usually is that we follow a low GI diet. So a low GI diet means that we're eating foods or carbohydrates that don't raise our sugars quickly when we eat them. So what happens if you're eating something that raises your sugar very quickly, your body will have to produce more insulin to try and bring the blood sugar down. So when that happens, that can also affect the hormones that will boost oil production on the skin. And if you remember how Dr. Jacobs was explaining about oil production in acne, you would understand that obviously this type of food that will boost the oil production, we should ideally be avoiding. So those types of food would be foods that are high in sugar. So your sugar-sweetened beverages, your fizzy drinks, your sweets, your chocolates, your refined carbs like your white bread, your white rice. In any way, these type of food are not good for our diet in general, as it is high in sugar. It puts you at risk of non-communicable diseases like your diabetes. So avoiding this type of food won't really affect you in a bad way. However, it can help to reduce that severity. There's no food cure, one food cure. However, eating the right food, feeding your body with the right types of food will have to keep your skin healthy and vibrant and young as well.
Now, we've spoken about good foods, where you mentioned that, food that has sources of vitamin A and D and so on and so forth. We've also spoken about foods to avoid for different conditions in order for you to have healthy skin. Now, are there foods that you can eat to make your skin better? Like something that you can take to just make you look brighter and glow more and fresher and less spots on your face?
Yes. We all obviously want to look like that, always to stay young. I think what's important also to remember is that nothing is going to happen overnight. Mm-hmm. So as much as your pumpkin and your sweet potatoes are filled with your vitamin A, which is good for your skin, it doesn't mean if I ate sweet potato today, I'll be glowing tomorrow. Mm-hmm. So it's important that you follow a well-balanced diet throughout, and you're not just doing a six-day challenge to keep your skin vibrant. However, if you follow a healthy diet, including all these vitamins and all these minerals that you need, your skin can continuously to stay young and stay vibrant. Obviously, if you are having any allergies or sensitivities, to try and eliminate that. What you can do as well, you can keep a symptom food diary or journal that can also help to see what sort of food triggers your flare-up. So if you are having a flare-up today, then you write, what did I eat? What sort of ingredients did I use in what I have cooked? So then you can see a trend of, if I add a certain condiment, then I get a flare-up. So also water, very important that we stay hydrated, we stay fresh. And again, our food-based dietary guidelines do encourage that we drink lots of clean and safe water for general health, but as well as for your skin health.
Mm-hmm. Now, let's look at this idea of beverages. So you've spoken to water, very important. They'll tell you to have 70 cups of water a day or whatever they normally say as dietitians. So water is important, but can I still drink as much as I want to drink on the weekend in terms of alcoholic beverages and still maintain a healthy skin?
Unfortunately, the answer is no. So you should, like you said, drink enough water, ideally between 6 to 8 glasses of water every day. It will be good in a way that if you are drinking your water, you're probably not drinking your fizzy drink or your high sugar juice. In terms of alcohol, again, it is not good for, in general, alcohol isn't good for your health. Even with the South African food-based dietary guidelines, it does say try and avoid alcohol. If you are drinking, then you should do so in moderation. So just because you didn't drink the whole week doesn't mean on the weekend you can make up for the whole week. So not drinking every day is good, but when you do drink, you shouldn't binge. And also, just because you ate well today doesn't mean for the rest of the week now you can eat all the sugar-filled beverages or foods. Ideally, every single day, your diet should be well balanced, it should be healthy, and it should be something that is sustainable to you. Hence, I said that you should consult a dietitian to get a personalized plan that works for you, for that you can be able to sustain, and not just the challenge that after 2 days, then you want your sugar back or you want the alcohol back. So it has to be sustainable. So alcohol, no, we shouldn't binge on the weekend. It won't be good for your overall health as well as your skin.
Well, thank you so much for assisting us and helping us and making us see the importance of food. Of course, that was Ntokozo Ngubane, the dietitian, telling us what to eat and what to keep in our system to make sure that our skin is as healthy as ever. Thank you to all the guests that joined us today. But most importantly, thank you to you for taking time out to watch the show. Skin health, how it's important and why it's important. And now you know what you need to do if you start having any flare-ups of your acne or start thinking that someone you know might have eczema. Go out there, make sure that you use sustainable foods within your diet. And remember, your skin will not be fixed in one day. It is a long process, but a process that you need to start getting on in order to have that big, beautiful glow that you've been dreaming about all your life. Thank you so much for joining us. And of course, that's the end of the show from me, Dr. Mosamthobeni, and the Vital Signs team. Goodbye.